Hello, everybody. Welcome to the latest installment of Frivolous Gravitas. This week, we've got our special guest star in today to talk about, to talk in her own field, where she will be guiding us through the role of a pharmacist in our society, in the community, what they do behind the counter kind of stuff, and their actual responsibilities in an effort to, demystify the these people's work behind the counter, and to, make it less of a priestly thing and more of a, well, with that in mind, I'll hand it over to Megan to get us started. So, where did you want to start with this?
Hi, everyone. I'm Megan, as you know. So I was just going to start by talking about roles of pharmacists, what pharmacists do, and then I'll let the other two ask me questions and interject, and if they have anything to say, they can do that. So, I'll talk mostly from the perspective of a community pharmacist to start, and we can get into more like hospital and specializations and other things, but community pharmacist is probably the one that you have the most interactions with. Like, by community pharmacist, what I mean is like people that, like pharmacists at Safeway or like a little independent shop, like Main Street Pharmacy or whatever. Like, that's what community pharmacist means. So your job mostly there is to prepare and check prescriptions, which is more complicated than what it sounds. So when you get a new prescription in, you want to assess if it's appropriate for the patient. So you're going to, but like before you even do that, you need to confirm, because it is another thing that we do a lot in pharmacy is we're dealing with health information, right? So there's a lot of like legal requirements and things we have to confirm. We can get more into that later if you guys want, but I'll keep it simple. We just need to confirm that we're talking to the right person and that we're not like giving information to the wrong person. You can't like walk in and be like, does my ex have an STI? Like, we can't tell you that. So there are cases of that. But so we'll start with doing a little assessment. So like, does this person need this drug? Yes.
Can we get into the more, like, I know this is, I don't want to like dive into the nuts and bolts right off the bat.
Okay.
What is, I'm thinking like more like the meta aspect of what a just to put my insufferable intellectual hat on, the like, why do we even have a pharmacist?
Okay, yeah, I can take a couple.
And then we can move into like what happens when a customer walks in.
Okay, sure, sounds good. So, well, it's easier to kind of imagine that you have someone that has some sort of issue. Say they've got an infection. Infections are easy. They got a skin infection or something. So they will usually go to a doctor first. Main difference between doctors and pharmacists is just expertise. Doctors have extra, like, way more training in diagnosing than a pharmacist does, and diagnosing is actually fairly complicated because most things aren't clear cut. Things show up a little weirdly. If you show up to your doctor with like tiredness and weight loss, there's like so many things that could be, and it gets very complicated very quickly. So that's where doctors are strongest, and they're very good at that, and they're very good at treating conditions where the treatment isn't necessarily drugs, whereas pharmacists are definitely experts with drugs. So it's not just, what does this drug do, but it's also, why does this drug work? How does it work in your body? How does it interact with your body? What changes does it make to your body? What changes does your body make to the drug itself? And things like drug interactions. So if you're taking two drugs at once, how do they affect each other? And what can we do to help so both those drugs can do their job? They can also help organize everything. Like with adherence, if you're on 10 or 15 drugs, it can be really hard to take them in a way that, like, there's usually a lot of rules. So some drugs are what take with food, some drugs are empty stomach, sometimes you can't have calcium with this one drug or whatever. So they just kind of shed a light on all that. So that's why you want to have a doctor and pharmacist working together, and when they are working together, that's when you get better care, really, because they do have slightly different expertise, though it does overlap quite a bit. But another thing that we do in our do in our medical system now that's built in is this redundancy. So a doctor will write a prescription. So you walk in with your little skin infection. The doctor will send you to get a swab, send it to the lab, but he can probably, based on what it looks like, you can usually figure out what it is, and then figure out what the best drug to treat those organisms is. There's ways to find that out. So the doctor will prescribe something, bring it to the pharmacist. So the pharmacist will look at the antibiotic, and they will have more the knowledge about how the antibiotic works inside your body, more and like exactly how to use it, and they can help a patient know exactly what to do. But you can also look at things like organ function and other things that you need to check when someone brings in a prescription. So it's definitely something that you are working together on, and there's also another time for patient education. One thing that is with at least our system here is that time with doctors is quite limited. Usually they only give you 20 minutes or so, and if you have more questions or there's more things you need to talk about, you can't always. They'll say book another appointment because they're paid by each section and they need to get so many appointments in per day in order to make money and stay open. So a pharmacist can basically be with you as long, like they're not paid by time, so they can answer more questions. They can set up time if maybe they're really busy, but even then they're always available. And another really big advantage to that is, say you have like a new sore throat and it's not COVID, and you're like, well, what do I do about this? Should I like go to a doctor? You don't know. You don't really want to go to Emerge because it's like Saturday and that'll be a huge pain, but you have a presentation on Monday, so you're not sure what to do about it, but you can't get into a doctor. Then you can always walk up to a pharmacist. They're always around. They're always there. And they'll usually know, they'll be able to figure out something, whether it's just, it might even just be, well, it sounds like a cold, so rest, drink lots of water. But it gives you can talk to someone that has some knowledge, and they're always available, pretty much. Like, pharmacists are open on Friday night at 9 p.m., whereas otherwise you would have to go to emergency for something that might just be minor. So that's kind of a place, their place in society is to, there's also a big point to dispensing drugs because drugs are highly regulated. So there's a lot of legal aspects to dispensing that pharmacists will know more about, and be able to handle all that sort of stuff.
So this sort of helped with like an educated guess, like a front line to sort of save the hospitals the expense of having to triage a bunch of people who don't need to be there, and doctors to have a bunch of appointments that they don't need to have.
Yeah, it's pharmacists. Pharmacists know lots about minor ailments. Like, they're very good at like things that aren't, maybe need like Advil, or maybe you just like fell and twisted your ankle but you're not sure it's twisted, or just like some things that like, and they're also like, we're also like very aware that we don't have the same scope as a doctor, and we know that we need to refer sometimes, that we need to send you off to your doctor or to emergency or something. Like, and we study a lot in like what we call like alarm symptoms or red flag symptoms. So someone walks in and they're like, I have some indigestion and it kind of hurts down my arm, and you know, I'm 55 and a little overweight and have been smoking, and it just suddenly happened and it hurts more when I exercise. And you're like, that's a heart attack. So you know, things like that too. So
but so you guys are situated at the end of the I guess one of the potential ends of the care process. Mm-hmm. So, you know, the person, the clerk at the front or the nurse at the front will triage the people in the waiting room, and they'll put them into the back, and then they'll slot them in to see a doctor, and the doctor will diagnose. I'm simplifying this immensely. And then, you know, they'll say, oh, it's just this, it's just an infection. Here's some antibiotics or something, or here's this or that. And what happens is that the pharmacist would act as another check on the doctor's, not opinion, but educated guess as to what is going on with that person.
Yeah. And there's a lot, and this has changed as well, is that there's like a huge emphasis on learning how to read evidence and how to get into evidence. So unlike in other scientific fields, like a lot, the evidence is written, like you have like your studies, but then people will like synthesize this and then make it into like easier to read resources. So you'll have a resource that's about this drug that may make reference to like 35 different papers on this drug, but it'll like write it for you in a way that's simpler, so that if a patient or you are checking a drug and you forget what's the right dose for like this indication, but their kidney function isn't great, you can just go look that up without having to read through 7,000 little tiny papers. So there's a lot of work being done in synthesizing stuff, but of course that comes with bias. So we learn a lot about how to read evidence and how to like find stuff that works and how to recognize bad evidence. Especially now they're changing degrees from Bachelor of Science Pharmacy to what's called a Doctor of Pharmacy. And one of the main differences is more clinic time and more time learning about evidence, how to read evidence. What's a good randomized controlled trial? What's a bad one? Why don't we use this? Why do we not like observational research as much? So there's a lot more of that's changing in the field. And I think that's for the better. Is the more evidence-based we can be, the better. Some fields have more evidence than others, and I think we can get into why in the next episode or the next part of this. Just some things are easier to study, and that means that they get studied more, which leads to some biases within evidence field. Like, for instance, mental health is harder to study, so our evidence on which antidepressant to use over which other one isn't as strong as in like heart failure. So we can talk about that more later, but
I think one other crucial thing, since we're summarizing just briefly what the pharmacist's roles and duties are, I find one of the biggest helps that pharmacists offer the community is through over-the-counter medications, just because the labels, first of all, are written so small that most elderly people or people with bad eyesight like me can't even read them. Second is it's not plain English to most people, so even reading a label doesn't really make sense to everybody. So it really helps to have that human person tell you specifically how your vitamins are interacting with this Tylenol, or how your use of grapefruit is interacting with your...
Oh, grapefruit, the evilest fruit.
Yeah. But over-the-counter medications, just as much as controlled substances and like scheduled prescriptions, I think is really important.
Yes.
You can really hurt yourself on over-the-counter medication.
You absolutely can. And like, just because you can buy something off the shelf without like talking to a pharmacist doesn't mean it's safe. Like, even something like decongestants, which are very common in like all cough and cold products, they raise your blood pressure. So you really shouldn't be using them if you're like have issues with your heart or you already have high blood pressure. It's not a good thing for you to use that. But like, that's written on a teeny tiny label on the inside of it, so it's not obvious. And if you're on a drug like warfarin or any anticonvulsants for if you have a seizure disorder, some of those drugs interact with so many different things that a lot of over-the-counter drugs are things that you should not be using.
Yeah, but you can't get rid of that jargon because it's extremely useful within and between pharmacists and doctors and in the medical side of it.
Right. Yeah,
so you have
definitely has to be there.
And so you have to be a translator, right? Essentially.
Pretty much. Like there's a lot of, because like, and one of the reasons why you use jargon is to simplify it to yourself. Like, it's more complicated to other people, but like if I'm writing a note, I'm going to put HTN instead of saying high blood pressure, because like that's faster and easier to type. And I know that HTN means hypertension, which means high blood pressure. And when I'm calling a doctor, if I only use the most simple words, the doctor might think I'm an idiot. Like, it's kind of you kind of have to use some of the words. But if you go like too hardcore, like if you watch medical TV is really bad for this, where they just like line up a bunch of big words together and it like sometimes doesn't even make sense. So I can't watch doctor shows.
My God, he's taking paracetamol. What do we do?
Oh no, not Tylenol. Actually, Tylenol can cause a lot of issues if you take too much, but that's another story. But it is definitely important to be able to explain stuff in a way that makes sense to people. And that's another reason, is because like drugs are complicated and there's a lot going on. So being able to just say like, yeah, this is and like cough and cold products are like the worst because there's 700 different types and they're all almost the same, but not quite. So you do really need to have someone there to help out Another thing that's really helpful is for children, because children are usually dosed based on weight. And that calculation is not always, like, it's easy to screw it up. Like, and so if you are like, yeah, my baby's 4, and so they fit, and like a lot of them will have ranges for like age and weight, but if you want to do the weight-based dosing, not the age-based dosing, but like that's not always obvious. So if your child is 4 but they fall into the like heavier weight category, then you might underdose them by saying, well, they're only 4, so I should use the lower dose, but that might not be enough to help them if they're like having a fever and you want to reduce their fever or something. So that's another thing that we do is especially with like parents that might not have dosed drugs like this before.
I think that might have gotten cut off.
Yeah.
Okay, so
I think last I heard when I got cut off was something about kids, their weight, and underdosing a fat kid.
Yeah, that's exactly what I was talking about without talking about it, but yeah.
Okay.
It's funny. It's better to talk about fat kids than kids that are like severely underweight, because that is sad. But being fat is just funny.
Isn't it sad?
It is sad, but it's not as sad as like starving.
Ouch.
So we did a case in one of our classes where there was a kid with autism that like wasn't eating anything because everything was gross, and their BMI was 10.
Is that even possible?
I don't think so. So yeah, they were very, very small. They were like, yeah, anyway.
So this might be a good place to actually get into the nuts and bolts now, because that was a good little through as to what a pharmacist is. So if I walk into, I go to my doctor, he says, you've got, something itis, and here's a prescription because we know how to deal with this. I walk into the pharmacist, and so I know what I go up and I say, I want this prescription filled, and you go, yes. And then you press the button that magically materializes exactly what I need. And then you give it to me and sell, and I pay, and then I leave, and that's all that happens, right?
Yep.
That magic process is. So what happens when you see me coming up to the counter with my little prescription slip?
So we see you doing that, and oftentimes you'll talk to like a tech or an assistant first, but it depends on how the pharmacy's going. So pharmacy techs are like a regulated profession, so they do have training in like certain things. It depends on like where you are locally. That like kind of affects that. And assistants are kind of just people you hire off the street that may or may not have. There's like a short college degree that you can do, but may or may not have extra training. But so what a pharmacist is looking for is, first of all, who are you and who's this prescription for? Start with the easy stuff, make sure you have contact information, all the boring stuff. And then you want to say, like, should this person be using this drug? Like, do they have a condition that this drug will help them for? And that's like your indication. So if you hear pharmacists talking about indication or this is indicated, that's what it means, is do you have the condition that this drug will help treat? And that's all it is. So if I'm giving you a blood pressure pill, but your blood pressure is actually fine, then why? Maybe there's another reason, because there are other uses for blood pressure pills. So we have to make sure that you have a reason that makes sense for you using that drug. So it's just like, should you be using it at all? Okay, that's your indication. Your next is, will the drug be effective? So is this drug going to work in this person? So that's about, and that one is sometimes easy to answer, but can depend on other things. Next one is safety. So is this drug safe to use? So some things like kidney function will fall into this, and other drugs that you're using, because sometimes other drugs can increase the effects of one drug or decrease the effects of a drug. So you need to be looking at that. And so if you have a drug, if you're taking a drug and then you take another one that increases the effects, then you might get toxicity, or you might get issues where you have too much of the drug in your system. So it might like make you super tired or very nauseous, or like neurological symptoms like tremors. Just depends on how the drug works. And then
Oh, sorry.
Go ahead.
Oh, I was just going to ask, what are contraindications, if those are what indications are?
Yeah, so contraindications is something that you can't take the drug with. So, for instance, what's it called? Accutane for acne. You cannot use Accutane when you're pregnant. That's just a hard no. Can't do it. So a contraindication for Accutane is pregnancy. Another reason you couldn't use Accutane is you had like liver disease, like severe liver disease. You couldn't use it as well because you need to have good liver function in order to clear the drug or get rid of it, essentially. So contraindications are just reasons that you can't use that drug. Another contraindication would be you're allergic. So if you're allergic to penicillin and you get a prescription for amoxicillin, which is very, very similar, and you will generally have cross sensitivity, then that would be a contraindication as well. There are also things, you can also have like absolute contraindications like isotretinoin or Accutane in pregnancy. And you can also have like relative contraindications. So if you, let's say you had a stomach ulcer, stomach bleed 2 years ago, and now you have a blood clot somewhere, so they want to put you on blood thinners that will increase your risk of bleeding, then like, oh, maybe you shouldn't because you have a history of bleeding, but like it's a relative contraindication because you might still be able to do it anyway if there's a risk and benefit ratio sort of thing that you would want to look at. So relative, you can still use it with a relative contraindication, but it would just kind of depend on other factors. So, but absolute contraindications are like allergies or sometimes pregnancy or just things that you absolutely cannot use the drug for if you have those conditions.
This is all happening before you even start filling out,
That depends on the pharmacy. So sometimes the pharmacist will do all the checks first and then give it to someone to fill, and then someone has to check again to make sure it was filled properly. A lot of pharmacies, you'll have techs handle the front half of the process. So the tech will talk to you, tech or assistant will talk to you, get your information, they might ask you a couple questions, like if it's an antibiotic, they might say, what kind of infection? They'll ask you things like, have you used this drug before? Is this the same dose? Did the dose go up or whatever? Like just a couple simple questions like that they might ask you. And they'll write it down on the prescription, and then they will like go get the drug from the back and count it out on the little tray and put it in a bottle and stick the label on it. And so, they'll do that. And then they will bring it over to the pharmacist to do the check. So then the pharmacist will start looking at, is it indicated? Will it work? Is it going to cause really bad side effects? And what are they? And what can we do about it? And are they going to take this drug? How are they going to take this drug? And what can we do to make it easier for them to take that drug? That's the last part of the assessment, is adherence. Will they take it? What can we do to help them? So sometimes you might have a drug that you have to take 3 or 4 times a day that might be difficult. So you usually have to talk to your patient about like, how do we remember to take a drug 4 times a day? And usually the answer is set an alarm on your phone or do it at mealtime so that you associate it with food. But
like right before bed or as you get up.
Yeah, like put your drugs beside your coffee machine so that when you make coffee in the morning, like
knowing humanity as I do, this seems to be like it might actually be one of the hardest tasks.
It is. Well, and the thing is, of course, the patients that you see a lot might be the ones that need more help and aren't taking their drugs regularly. And there's a lot of reasons why they might not. Some of them are just, I'm really forgetful and I can never remember no matter what I do. Some people will go on the internet and will read that, oh my God, statins can cause you to die from rhabdomyolysis, we know that as healthcare professionals that this can happen, but it's extremely rare. And in all the cases of that, the patients had other comorbidities or other things going on. So we know what to look for, and we're doing lab tests to monitor for stuff. So we know what's going on, usually, hopefully. But sometimes people will just stop taking something because, well, it's not working anyway, or they don't really understand why they're taking it. So one of the important things to talk to, and again, it can be difficult when you're working in a place that's doing 300 scripts or more, 500 scripts a day, and there's only one pharmacist on at a time. can't spend very much. That's just a prescription. So you're filling 500 prescriptions in one day.
Okay.
Yeah.
So you have to abbreviate the word to script when you're doing that many.
Yeah, because you don't have time to say the full word prescription.
Abbreviate that. Stat.
Yeah.
But also, I think one of the other things to mention with that is a lot of the times the symptoms themselves prevent people from taking their own medication. Like for somebody who has difficulty eating, it would be hard for them to take a pill with food because they're spending a lot of energy and mental faculty just trying to get themselves to eat. It's sort of an afterthought to take the pill with the food, and then sometimes like memory could be a symptom of a condition that you're trying to treat.
Alzheimer's or something.
Yes, yeah, that can be challenging. But like, and that's one of the things that you want to know as a pharmacist. Just say you do have someone that like, because there are some drugs that you need to take with like 300 or more calories, and it's like eat with a fattier meal, and just there's like some very specific requirements. Not very many drugs are like this, but there are a few. And if your patient can't really do that, then you should choose another drug, because that another drug might be more effective. But sometimes you don't really have a choice. Say they've tried the other few drugs in the class and they don't work properly, or there's something else going on with them, and this is our only choice. You kind of have to try something, and it's better to take a drug with like, if you're supposed to take it with food, it's better to take it with like a handful of peanuts than nothing at all, if that's all that you can do. So yes, it can be difficult and complicated, but you kind of have to try to think as best you can and maybe make what you're doing suit patients, because that's kind of what we're talking about more and more emphasizing, is less like just following guidelines blindly, and more like, what's this patient going to do? Like, is this patient going to appreciate taking 5 drugs 4 times a day when they are working 12-hour shifts? Like, no, they're not. That's not going to happen. So find drugs that work better for their schedule. And that's something that's being emphasized a lot more now, and I think we're getting better.
And that sort of comes down to, I guess, communication between the pharmacist and the licensed practitioner who's issuing the prescriptions too, right?
Yeah, that, and involving the patient too. So
what kind of communication lines do you have between pharmacists and the doctors?
It, again, kind of depends on where you are and how it works, but at minimum, you'll fax each other. And because like a lot of times we still use faxing, because technically you can't send health information over emails, so it has to be faxed, which is annoying. I had to get taught how to use a fax machine when I started working in a pharmacy, because I'm like, yeah, it's like 2020. Like, of course I don't know how to use a fax machine. Like, so yeah, now I know how to. And so at minimum, you'll like send notes to each other, because you might say you change a prescription because, well, sometimes the doctors are human too. So sometimes they make a mistake. They'll write the wrong dose, or they'll write like they'll write a dose that doesn't exist in tablets. So you just assume what they meant and then just change it. You can do that as a pharmacist. So then you can just fax them a note and says like, yo, you screwed this up. I fixed it. Thanks.
Or if you can't read their handwriting or something, then you can sort of double check with them. Yeah,
and then you can give them hell for
don't read
not writing properly. That's not as much like there are still doctors that write prescriptions by hand, but a lot of them are like on computers and electronic now, so harder to screw up. But then you can also get them, they just like pick out straight up the wrong drug, so.
Or typos or something like that.
Yeah, and you're like, that is not a drug. You like Google it, and you're like, does this doctor know something I don't know? They just misspelled something. So
this guy needs 10 milligrams of Dragon Ball Z.
That's what everybody needs. Yeah, but so yeah, you have to. Part of it is to just check and make sure that there's no mistakes, and then the last part of the pharmacist check that I didn't really talk about is making sure it's filled properly. So. Did they choose because sometimes there's like formulation issues, like you have like naproxen is a very common drug that's used for pain. It's kind of like Advil, but you only have to take it twice a day. It's also Aleve, which is over the counter, but there's a prescription strength. But the prescription strength comes in like a regular tablet and an enteric-coated tablet. So that one sometimes gets messed up by the people filling it, especially if they're newer. So that's something that you're looking out for, is did the doctor write naproxen EC, and did you actually use the enteric coated? Because it's just a little easier on the stomach. That's all it means.
Is this redundant? So this is a like a redundancy measure to make sure that they're going to get the right. Is this a necessary redundancy, or is it like if the pharmacist trusts the tech or something? Or
you still have to check it. It's
Okay.
part of the checking process, which has to happen.
Makes me feel
And the
better.
check has to be done by a pharmacist. It can be done by a tech. Again, this is regional. Techs can sometimes do it for like refills where there's no issues, but that again depends on your area. But generally, it's going to be a pharmacist that's like, especially if it's a brand new prescription, you've never used the drug before, then a pharmacist is going to look at it. But they are going to make sure that like you picked the right pill, because like sometimes you grab the one beside it, or you grab the wrong dose or whatever. Like you're human, so you will make mistakes, but you try to double check everything as best you can. The pharmacist won't recount unless it's a narcotic, because there's like extra things for narcotics to make sure that things aren't being.
For the boring people in the audience like me,
Yes.
what's a narcotic?
A narcotic is a legal term. And it refers to drugs that are like more highly controlled. So generally when people say narcotic, they mean opioids, but narcotic is a legal term. So but yeah, like it's by that I'm meaning drugs that are like more highly controlled, the drugs that need to be locked up in a safe. So your opioids are one. ADHD medicines are in there as well. There's a few, and like testosterone injections are in there. So the drugs that are more highly legally regulated are what we refer to as narcotics. So usually there's an extra step of checking to dispense these, to make sure that you're not dispensing too much and you're not losing stuff, or that there isn't anything sketchy going on. Because it definitely occurs that people are selling narcotics out of a pharmacy, and that's obviously not what we want. So they have all these extra procedures in place, which are kind of boring, but important.
So those will generally probably be the ones that are more dangerous or prone to addiction, right?
Yeah. So like the ADHD meds are amphetamines. So some of them can be, and like they can be like crushed and injected, a lot of them. Some of them are like more tamper resistant. And your opioids as well, which are very addictive, as we will get into more later. But and like testosterone injections also are abused. So it's generally stuff that's more easy to abuse. But then you have stuff like benzodiazepines, which don't have to be locked up in the safe necessarily, but you still have more procedures when you're dispensing them. But again, that's a regional issue as well. And like in Canada, the narcotics and like that kind of stuff is defined by federal legislation. Other countries do it differently, so I can't really speak to other countries.
So the federal legislation will put something on a scheduled controlled substance, but the province will dictate how you manage and deal with it?
The federal does have that sort of stuff in it too for how you deal with it, but then the college will, because like the federal will have like some rules, and then provincial can add more rules but can't take away from that, right? And then you'll have your provincial government doing stuff, and then you'll have your college, which is like your college of pharmacists, your college of physicians and surgeons, and you have to be a part and pay into the college to practice, and they regulate things. You have to take a ethical oath. You have to know like Alberta procedures if you're in Alberta, or Manitoba procedures if you're in Manitoba, or whatever. And you have to write an exam to practice in that province about like the legal requirements in that province specifically. So there is a lot of legal stuff that you have to know too.
So the government, when they're making up these rules and laws, I don't mean to say that so like
made it up.
Just made it up.
But when they're writing them, are they consulting with the college to write these rules and regulations, or are they just sort of using common sense based on?
There are like groups. There are groups that like non-governmental associated groups that the government consults with for these sort of things, that are usually made up of pharmacists, doctors, nurses, other medical professionals,
how do they
lawyers. So,
oh, sorry.
I can't say I know exactly what it is, but I do know that there's definitely healthcare professionals involved in making the laws, for sure.
That's reassuring.
Must be nice.
Yeah, like I
Keeping
did
the
have
dollar
professors. I did have professors that were like associated with like the government and like some of those bodies to deal with passing laws and negotiating with pharmaceutical companies for bringing pharmaceuticals in to Canada to be approved by Health Canada. So that's
And so is there an
stuff up there.
international kind of consortium of these people that sort of coordinate together as well?
You know what? I can't answer that. I don't know.
Because like if you get your pharmacy tech license or something, right? Like not full pharmacy, but just a tech, are you able to go to another country and practice as a pharmacy tech in some other countries too?
Usually not. Usually you have to write some sort of equivalency exam of some sort. And it's kind of like that with just pharmacists and with doctors. Like there's an internship program for here for people moving from out of province or out of country that you have to like fill a certain amount of internship hours where you get paid total garbage. And you just have to prove that you can work there, and you might have to like write equivalency exams, which can be difficult and costly. So I have worked with clerks that are actually doctors from other countries, but just couldn't do the equivalency. It was too much work. They'd have to like basically go to school again. And so that's kind of an issue. So if you do want to, it's definitely easier to practice, to not move around too much once you get a professional degree like this, because you usually do have to go through some stuff, even moving provinces in Canada, because technically each province has their own healthcare system. So you do have to write an exam if you want to practice in a different province and do some internship hours. So
like there's a lot of different definitions of drugs when we were in Italy. We tried to get some Benadryl, and they were like, "No, that's a controlled substance," and we're like, "Really?"
Well,
like,
I mean,
the rules are like how they classify something is different from jurisdiction to jurisdiction.
The EU has their own rules for how they schedule drugs as well. Like, there's some drugs that they just like hand out. You could buy over the counter that are like illegal to use in Canada and the US. So like there are things like that, and there's definitely some differences, but each country kind of determines how highly to regulate each drug. So
like something like Viagra up here is exceedingly expensive, and then you go down to the States and it's just candy.
You just buy it over the counter, which can be dangerous because it does interact with stuff, and there are issues associated with it, which is why it's a prescription drug here. I can rant for a very long time about how I don't think it should be this expensive, and I think it should be covered more, but that's another issue.
But I think it also goes for like antibiotics, because if we as a country, not necessarily because they're harmful, but like the harm is using antibiotics when you don't absolutely need to because of antibiotic resistance. So sometimes the government will put regulations and restrictions on people's access to medications just so that they're effective when we need them to be. Whereas some continents like Africa, I think especially, and like Poland and Ukraine and countries like that, I'm not sure of those two specifically, but some other countries you're able to buy antibiotics straight over the counter just to preemptively sort of attack a stomach flu or something.
You can also buy, there are countries where you can buy it if you're a farmer for your animals as well.
Oh, yeah, that's right.
But like amoxicillin is amoxicillin. If you buy it for your cows, it's not like you can't just change the dose and take it. Like it's going to taste awful. But there's a reason why we put drugs into capsules and tabs, and it's because most drugs taste disgusting and they're gross. That is definitely a reason. But yeah, like that does happen. And another thing, like antibiotics, and that's like one of the advantages of Canadian healthcare, is because there's so many like hoops to jump through, because everyone wants to not spend as much money, but then they end up spending so much money trying to not spend money by adding more bureaucracy. Classic. Then you like can't jump to the big boy antibiotics just because you feel like it. You kind of have to have a reason why you want to jump to the big boy antibiotics, like your vancomycin and your carbapenems and stuff. But in somewhere like the United States, where you can jump to the big boy antibiotics because you want to pay for it and you'll give the money to do it, they actually have more like multi-drug resistant, like Staph aureus, like our MRSA, and they have higher rates of these like multi-drug resistance organisms because because you can just jump the gun and buy stuff. So that's
actually kind of interesting too, since you brought up the animal thing. Does that mean pharmacists actually dish out medications to veterinary hospitals and
so
stuff?
generally vets do have dispensaries, but for some like more weird medications they might not. Like I gave phenobarbital to a dog I dispensed. I was very confused because it was my first time working in a community pharmacy, and it was like a prescription for Fluffy or whatever the dog. It was a very like dog name, whatever they named him.
Fido.
And yeah, something like that. And it was like phenobarbital, and I'm just like, what the heck? So the reason is because phenobarbital is also a narcotic locked in the safe. So, and I believe the dog was using it for seizures. And because it's just a drug that is like in a controlled, they had to go to a human pharmacy to use. So yes, you do get a few dog and cat prescriptions, but generally, like you won't get farmers. They have other methods of getting it. So yeah. It is always kind of funny though when you get one, because you'll like in your software it'll be like Fido and then in brackets dog, so you don't phone and be like, hey, is this Fido, because your prescription's ready.
Yeah.
Yeah,
it's kind of funny though, because they use a lot of medications that would be abused on the streets, I imagine, like ketamine and stuff, to put animals under before a surgery, for instance.
So they still have to follow the procedures of the scheduling, so they'll know about drug scheduling and like what procedures you have to follow to do it. So they still have to follow the laws, even though it's not for human use. They're still drugs. Yeah.
And is that like a common avenue for, like, I know we'll get into it in the next episode about drugs and stuff, but I'm just curious from the pharmacy perspective, is it common that a lot of these medications are taken from pharmacies through vet hospitals as opposed to through...
I don't actually think so, because I don't know if, like, I can't tell you that.
Seems like a pet prescription would be easier to forge than a human prescription, is sort of what I'm getting at.
I think you usually get the drugs from the pharmacy itself. So, I mean, from the vet hospital itself. So, like, the vet will also give it to you. So it's pretty hard to forge that when, you're getting it from the vet itself, right?
Yeah, sorry for the tangent. Out of that.
No, it's a reasonable thing, because, like, people are getting the drugs from somewhere, right?
All right. So just one last question in all this that before we move on is so that's kind of how a pharmacist, everything we've talked about up till now was what a pharmacist does and kind of their role is their job and their role kind of in the community. But it's an evolving profession. Where is it going from here?
Yeah, that is a good point, because we do have an issue right now where things are becoming more and more automated. So it is completely possible to automate the dispensing of drugs. There are already machines that do that. They just cost like over $20,000, so they're not used super often, because that's a lot of money. And so what a lot of people are seeing in pharmacy is that what we need to do is stick more on our clinical role and our role of talking to people specifically. So instead of just being drug dispensing machines of like, beep, boop, here's your Ramipril, focusing more on the actual interactions, talking to people and doing things like medication reviews, where you sit down with someone, especially someone with like with a few medical conditions and a lot of drugs and just maybe some complex other factors going on in their life, maybe like some difficult social situations or something, to sit down with them and just talk about, this is this drug, this is what you're using it for, and yeah, you should keep using it. Or this is this drug, I'm not really sure why you're still on this, so we're just going to stop it now.
Or
and
like
just
setting up like a habit or some kind of process that they can make sure that they take it, and maybe even set up, like, get them intimately aware of how this is going to
one of the number one,
so they actually take it.
Yeah, and one of the number one reasons people don't take drugs or stop taking drugs is just because they don't know why they're taking it. So you really have to emphasize to people, like, why are we doing this? Why are we treating it? Like, yeah, your blood pressure's high and we want it to be lower, but those are just numbers. Why are we actually treating it? And those are the types of things that we can be there to ask. And so in the future, pharmacists are probably going to have big drug dispensing machines where you just throw in your prescription and then something just pops out that's the right one, but you still will have to do that consult to like have some sort of either face-to-face or like cool fancy future video hologram thing of a pharmacist, just to be able to talk to somebody about what it is that you're doing and why you're doing it and how to integrate it into your life.
Well, and it'll be a liaison between the drug, the not that I want to say customer, the drug, the patient, thank you, and the doctor as well, because the machine, like the doctor could just send it to the machine, but the machine doesn't, as far like as yet, they won't be able to, you know, switch to a local vernacular to be like, here's what's gonna happen.
Well, yeah, one of the things that's gonna happen in the future too probably is you're gonna get better integration of like medical records and health and like evidence, essentially. So you'll have a program that can see everybody's health information, but then they can say, like, based on your last few visits and your age and your, you know, blood pressure at those visits, you actually, and like the fact that you have this condition, you actually probably should be on a statin. So here's my recommendation to start a statin. And then the doctor can do that, can say that. So that's probably where things are going in terms of like integrating medical records and evidence streams. And
well, even databases. When I went to get my vaccine a while ago, not the COVID vaccine yet, maybe soon, but they asked me, they made me bring in all the paperwork from my Manitoba vaccinations, and so I brought that in, and I had also gotten flu shots in Alberta. I was like, oh, those should show up on the database. And I just assumed that they had a linked database for all of Alberta healthcare. And that was not the case. When, if, you know, everyone in healthcare could access with, you know, with proper access restrictions and, you know, security, blah, blah, blah. But if they could access just my medical file that would be held on the, you know, Alberta or Manitoba or Canada, like some medical database where, you know, every doctor wouldn't have to just go and like
guess, because you don't want to guess. You want to know what the actual history is. And like there are systems, each province kind of has their own system. But again, that's part of the problem. So if you move to a different province, then you're basically a blank slate. So that can be kind of an issue. And like they're getting better. They're having like sections where you can add vaccines, but it's just really, really hard to change anything because there's so many hoops to jump through because it's health information and security, and you're dealing with a government body that's just filled with bureaucracy. So making changes and making improvements just takes a really long time, and all the systems are still kind of clunky. So
my thought, and just to kind of bring this into I guess it's still in the same vein, but the problem that we have with pharmacists, besides the, you know, anti-vaxxers or whatever, is that you guys work in places where there is little, I guess, prestige. So you'll work where the people need you, which means, frankly, you'll be in Walmarts and Costco's and, you know, in small towns. But like the perception is that a pharmacist is a retail clerk.
Yeah, and like you can get sucked into it, and a lot of corporations can sometimes be limiting to work for a corporation like that, because they'll do things like make you do quotas. So you have to do this many care plans. So care plans here, you can like charge the government for every care plan you do. So they're making money off of it. So they'll have like quotas of you doing things, and they'll like make you promote the store. Like maybe the store is having like a sale in electronics, so they want you to promote
points card.
Yeah, well, that you can't do points cards on prescriptions anymore. That changed a few years ago, at least here, which I completely agree with. And you shouldn't be incentivizing buying.
They're like at a like a Walmart or a Costco or a Shoppers Drug Mart. For people not in Canada, that's a like corner store. I don't know if they have that anywhere else, but that there's usually it's got groceries.
It's a chain pharmacy.
It's a chain pharmacy, but it's got a lot of other stuff, and usually has a mail office in there. But like if you're like one of your bosses is in your like chain of command, there is the front end manager who manages all the employees in front and the tills, and they come up to you and say, this guy's complaining that you won't sell him this, and he tries to override your professional opinion. What happens in a situation like that?
That can be problematic. So at that point, we're supposed to have our own autonomy, but like there have been instances of people butting heads over stuff like that, where I did hear a story about a pharmacist like refusing to sell somebody a narcotic prescription because the patient was showing signs of misuse. And the front store manager, and like I think in this situation it was like it was a late night and the pharmacist was like tiny, and she was afraid of this person and got the front store manager. The front store manager got involved and was like, "Well, just give it to him," and that's not correct. So yes, there are issues with like trying to fit in a regulated professional into like a corporate plan and into this like corporate idea of something. Yeah, there's definitely issues there, and I know a lot of people that I go to school with at least are very like do not want to work for corporations, and some are just like willing to put up with it because money and a job, and it's pretty stable. If you've been working for a corporation for a while, you're probably good, and you'll get your foot in the door, so you'll be working at that one place for a long time probably. So that
sounds like a pretty complex issue, though, because on the one hand, you've got doctors prescribing medications, and then you've got a corporate pharmacy trying to make money because they're a business, and then you've got them billing the government because in Canada we've got covered healthcare. But like, just a short correction though, like Shoppers Drug Mart does have a rewards program. They pay out points on
yes.
Build out.
Oh, well, okay, they can't do that here, so maybe
so it's just a province by province thing. Yeah,
yep.
Which is weird to me because if you think about it, most people who are on prescriptions regularly, like the ones who need most of them, they're probably either disabled or elderly or not working. So the points program is actually pretty helpful to the poor communities.
There wasn't a big issue with people picking up prescriptions that they were prescribed just for points, especially people that had like full coverage on things. So they would just go pick up prescriptions just for points and then just like sell them, get rid of them, throw them out.
Isn't that more a problem with the doctor prescribing medications that they're not using though? Like it's sort of punting.
Of course, that's part of the problem. But like, people like it was people taking advantage of the system. But it also like you don't want to incentivize drugs. You don't want people like of course as somebody if you have a pharmacy business, you want people to be on drugs, but you also want to limit. There's a bit of an issue too as well because we're trying to work a lot on what we call deprescribing, which is just taking people off meds that they've been prescribed. Sometimes people get prescribed a med they're supposed to be on for 2 months, and then 5 years later, you're like, why are you still on this? That does happen. I'm talking about you specifically, PPIs, pantoprazole. Yeah, so
But to me, it seems like the lesser evil. I mean, you're basically kind of criminalizing the people who are trying to make $100 in points per year for the people who are costing the government $10,000 to issue those prescriptions that the patient doesn't need.
Yeah, well...
So to me, it's less about the rewards program and more about the prescription system.
I suppose, but
I'm biased because I collect points on all my prescriptions.
Right? It would, yeah.
But it makes a difference to be able to get a new pair of gloves in the winter that I couldn't afford.
Yes, and that makes sense, and that happened to a lot of people. There's a lot of people complaining about that when it first came up, but it was about the idea of incentivizing drugs that was like the big, like it's like a higher philosophical, ethical idea that like I'm willing to sit with because yeah,
I can definitely appreciate that. That's why I say it's complex though, because it's not so cut and dry as to say like these people are getting incentivized to pick up drugs they don't need. But I mean, realistically, the rewards programs aren't giving them
you're not getting
more
a lot.
than $100.
No, it's not
like,
a lot.
It's not like they're running away with $1,000 per year, but the real cost is in the prescription that they're paying the pharmacist. So like the incentive is more about the pharmacist and the government than it is about
but the government didn't want to be paying all that. And like there is like pharmacy like payment models and stuff changes, that's also that like changes, because like pharmacies are businesses too, and a lot of pharmacies don't actually make very much money, if any, and kind of depend on front store sales. So like your over-the-counter medications and like Hallmark cards or
chocolate
cosmetics
and
lottery. They used to be able to sell smokes in pharmacies, but not anymore. Yeah, but it didn't really make a whole lot of sense. Like, go pick up your smokes and your heart meds, like,
and
what?
your nicotine patch, all at the same time.
Yeah, and your anti-nauseants for the chemotherapy. Yeah, no, yeah, so that stopped. But like, a lot of stores do definitely depend on that front store to make profit. So it's definitely, that's why you do see a lot of pharmacies changing hands and getting rebranded every few years. It's a hard business to keep open.
I think this is probably a good place to bring this to a close, but it sounds like a lot of it's up to, because every person's going to have their own circumstance, and it's kind of up to the pharmacist to be that ethical, have that ethical quality. So one last question to round it all up. How does a consumer, because you are going and spending your money, even if you are, or your tax money in Canada on drugs, how do you tell what is a good pharmacy and pharmacist from others? Because like you go walk down the street and there's, you can like, you type in pharmacy into Google Maps and you can just, okay, I got to go to one of these. How do you know what's something that the average person can do to tell which are legit, which are kind of mediocre, and which to avoid?
So it kind of depends on your priorities. If you want to have the cheapest possible pharmacist without, really anything else, go to Costco.
No questions asked.
Yes, Costco is the cheapest. You're welcome for advertising for you. Now pay us for this video. No, I'm kidding. But but you want to, if you actually speak to the pharmacist, that's better. If you can actually talk to them in the process, that's what you want. And another thing that is another sign that you're at a good pharmacy is if they are following up with you. So say you pick up a new prescription and they call you a week later and say like, hey, how's it going? Do you have any side effects? Is everything all right with it? Is there anything we can do to help? Like, that is something that's good. So you having
a mechanic do that for me and I was impressed.
Yeah, no, it's definitely something. And like, it's hard to rationalize sometimes because you're like, people don't want you to call them and ask them a week later, but it is a good sign that your pharmacist is actually caring. And like, just ask them questions and see how they answer. If they give you, because you want them to be like able to help you and not be rude, even if they're busy, right? So you just like,
and professionalism trumps enthusiasm every time.
Yeah. So it's professionalism. So like, cleanliness is a good sign. Like, is it organized? Like, it doesn't have to be like sparkling at all times because there's lots of people moving around in the dispensary, but like, things beat looking organized and people looking happy together. Just like general things that you would see, like
normal retail stuff.
Same
you do for like a restaurant.
The thing is, what they're doing is really, really important. So like,
even though it looks like they're
normally
just
in a company, you just look for that kind of stuff as a perk. But with a pharmacy, you really want them to be on the ball, professional. And that means not giving short answers to questions, like giving the long, boring finger wag, because that's what patients need.
And
that's what
like, another thing, I don't want to like just only talk against corporations. It's not that corporate pharmacies are all bad. There are some really, really fantastic people
Shoppers
working.
Is fantastic.
And yeah, I've had good experience with them so far. And it just like, it depends because each store will be slightly different. But like, it's not to say that like, it's pretty convenient to drop off your prescriptions and go grocery shopping and then pick them up again. So that there's nothing wrong with that. You just want to be sure that things are being checked over well, because pharmacy has this like constant struggle of being both a business and a service at the same time. So you really have to be able to balance that as a pharmacist. Like,
and they need
I have to make money. I have to make money, but I also need to follow all my ethics because we do sign ethics. clauses.
still say they should make you guys take Hippocratic oaths right at the beginning.
We do take ethical oaths. It's just not the Hippocratic oath. Specifically.
Socratic oath.
It's close enough. Yeah.
So
But
I think
I wanted to ask a question before you close up because you keep steering me off here.
Jordan.
But just before we finish up, I just wanted to ask, like, we're talking about pharmacies and their role in the public. What about online pharmacies as far as the future goes? There's obviously a role for them because I think refills that you've been taking for 10 years and you know they work, like, you really don't need to occupy somebody who's customer service focused.
Yeah, so, there's good and bad. Like, a lot of people are like very traditional and like, no, this is not good. We need to like make sure people are still coming in all the time. But like there's a role for it, and there's a role for, especially in COVID, there has been more pharmacies that have like tried to do more virtual meets to just like talk to someone on a platform like this to just say like, hey, how's it going?
So much
and talk
lately,
and like phoning and extra stuff like that. Like there's a role for that. But
they do like diabetic training and maternal training. Like they help women who are pregnant who can't go to Lamaze and have special classes to teach them how to give birth. Like the pharmacists already do a whole bunch of little things. Or not little, like big side things to the drugs themselves.
A lot of pharmacies you'll see will host like diabetic clinics where you can learn about like diabetes and how to test your sugars and things like that. And they got the
blood pressure monitors. They actually show you how to use it. Like, no, you have to sit down for 5 minutes first. Like, they show you how to do things properly. And if you ask them about weight problems, they'll tell you about nutrition and vitamins and.
Yeah, not to say that we're experts on all of it, but we have at least enough of a baseline that we have enough of a baseline that we can like give you something without, and then maybe refer if we need more.
You guys also have access to the database. Like, part of learning is learning how to find and do quick research too. So like, you know enough to go into the database, be like, oh, I didn't know that. Read everything you need to, absorb it, and be like, okay, here's what's going on. Rather than, hey, if you showed that to them, they'd be like, cool.
Yeah, like there's definitely a portion to our learning that's just someone walks in with this like weird rare genetic disease or this like just something rare that doesn't happen very often that you didn't learn about in school. And so what do you do about it? They're using this drug to treat it. Does that make sense? And you go, oh, I don't know. So you have to be able to find it. That's definitely part of it. But just to like sort of wrap up with that too, like there is some always discussion in pharmacy about how to balance your business side and your like services side, but it's something that we're all aware of and that we're all we're all trying to do what we can to like serve as well as we can, but also make money because we want to keep our jobs, right? So
I think that's really important that we give our feedback to the pharmacy. Like we should be able to, as the public, be telling the pharmacy what they're doing well and what we'd like to see them do differently. Yeah. Because for them to just unilaterally try and figure out the balance is not really fair.
Well, and at this point, like, I don't really know what a patient thinks when they walk into a pharmacy now, because I don't see it that way anymore. So I depend on, like, asking people around me, like, what their experiences were like when they went into a pharmacy and what did they like and what did they not like. And I'm trying to integrate that into what I'm doing, but, like, that's still not always correct. I'm just asking people that I know who may not tell me the truth because they are my friends or family.
Yeah, so as a call to action for the audience, I suggest that even if you've got nothing to say whatsoever, that's a good pharmacist then, because they're not dropping the ball. They're not enraging you every time you go.
And errors and you might get errors. Like, it does happen that the wrong bag gets sent out, or like their mistakes do happen and they do occur. But like, if they can deal with it professionally and responsibly and give you a good, not reason, but like a good answer and say something about what they're going to change in the process at their pharmacy to help address the issue, then that's good. That's okay. Mm-hmm. If they give you the wrong drug and they just go, meh, happens, and then leave you, that's bad. Don't go back there. But if they do put effort into like trying to help and trying to make you feel better about this or whatever, like, that's reasonable. So
in my opinion, one of the few bureaucracies that works really well so far and right now is the pharmacy. Like, I think we could even transpose that into a whole lot of other areas of our civics.
We do a lot of work with workflow and stuff because it's so easy to have meta errors.
Mm-hmm.
So
but
easy.
how you go about correcting them, like not trying to cover it up or sweep it under the rug. Like a pharmacist will take ownership and they'll fix it.
Yeah, and we talk a lot about like root cause analysis and just like higher level ways of that that you use to help fix your system, because when you have a problem, you don't say, that was Jimmy's fault. Jimmy dropped the ball on that. He chose the wrong drug up off the shelf. And it's like, yeah, but like what was happening? Oh, you mean Jimmy was working, was on his 13th hour of work because, someone didn't show up? Well, maybe that's really the problem.
Yeah, or is this the third time and you haven't mentioned it to Jimmy yet?
Yeah, and he hasn't noticed, or he's like, there's something wrong with the process, like the pharmacist isn't checking it or something, like I don't know. So there's we do our best, but thank you.
Yeah, but credit where it's due, because I think without it the public would be just taking drugs from basically drug dealers on the street corners if we didn't have the whole ethics component to it.
Yeah, and the other thing too is for also call to action, ask your pharmacist questions. They know a lot of things, and if you just have an ache and pain and you're not sure if you need to go see a doctor, just talk to a pharmacist first, because they might be able to say yeah, you should definitely see a doctor, or maybe it'll be take some Tylenol, give it a couple days, maybe it'll go away. They'll know that. So give them a call. They're very easy to access, but they still have years of training, so yeah.
All right, I think that's a good place to put it down for a moment. And
yeah, thanks for coming on the show. We really appreciate the insight.
Yeah, no problem. Thanks for having me.
Yeah,
been watching Frivolous Gravitas. Jordan Roy, Megan, and myself, Chris Driver.
Check back soon. We'll have another episode,
follow-up episode.
The following episode on the actual making of drugs and what's going on in there. Pharmacists are one thing, but what are they actually dispensing? So if you're interested in that, come see us on our next episode. See you guys.
Talk to you soon. Bye.